And we're live. Hey people, how are you? Welcome to the Sports Therapy Association podcast, recorded live as always every Tuesday, normally on the Sports Therapy Association YouTube channel. My name is Matt Phillips, creator of runchecklive.com, and we are streaming to YouTube and also live to the Sports Therapy Association open Facebook group. And we might keep doing that because some people do prefer to join via Facebook than YouTube. But if you do join via the Facebook group, then you do need to, if you want to leave comments and questions for our guests, then you do need to click a little link just to satisfy Facebook and their privacy rules. There is the link inside the comments on the original post, but I'll also put it up here at the bottom of the screen so you can see that. But if you want to just copy and paste it, then go to the original comments on the post and you'll see it. It just means that you're giving your permission for your photo to come up when you ask a question. Otherwise, you just see Facebook user. So there we go. If you're on YouTube, don't worry. YouTube are far less stringent and you can just put whatever you like unless you're Russell Brand. Right. So we are continuing our countdown to Therapy Expo 2023, which is happening at the NEC Birmingham this November, the 22nd and the 23rd. Very exciting for soft tissue therapists. If you have never been before, then there's a nice, interesting article in the Sports Therapy Association newsletter that came out recently. Thanks, Jake, for that, which explains what it's all about. Or you can just tune in and we'll be talking about Therapy Expo and the benefits for soft tissue therapists to visit it. Fantastic CPD. And the STA Update Theatre, which is within the Therapy Expo, is going to be brimming full to the brim with speakers over the 2 days. In the last episode 166, my guest was Dr. Lucy Williamson, award-winning nutritionist and founder of the Gut Health Project. If you didn't manage to listen to that, then that's on YouTube if you want to watch it, and also on all popular podcast apps. Dr. Lucy Williamson is going to be opening up day one of Therapy Expo in the STA Theatre at 9:15 a.m. It'd be lovely to see you there with coffee in hand to start the whole event. In the STA Theatre, and her presentation is going to be personalized nutrition for the future, gut microbiome. If you're interested in that, you want to hear more, then listen to last week's podcast, which is episode 166. Tonight, actually, just by coincidence, my guest tonight is actually guest number 2, in no particular order, but guest number 2 on the Wednesday at Therapy Expo. It's Lucy Gillbanks, ex-international athlete and researcher with 2 medical publications focusing on the effects of relative energy deficiency in sport, commonly known as REDS, red-S, which I imagine most of you are probably familiar with. As I say, Lucy Gillbanks is going to be in the STA Theatre at 10 a.m. on day 1 of Therapy Expo, presenting relative energy deficiency in sport, what therapists need to know. So it's going to be a real excellent chance for, we say therapist because it could be sports therapist, it could be sports massage therapist, it could be a sports rehabber. Everybody is going to see, particularly if they're athletes competing, potential risks for relative energy deficiency, which Lisa is going to go into. So you can spot things, know what to do if you do suspect, and just use the time you spend with them to give them the best service possible. So join us in the STA Theatre. But if you're here listening to the podcast, then even better, because now we're going to bring up Lucy Gillbanks. Hey, Lucy, how you doing?
Hello, yes, good, thank you. Are you?
I'm very well, thank you. Yes, I should actually say now, because we've been chatting a bit off air, there seems to be a few gremlins in the system. So if you're listening live, then and suddenly one of us disappears, don't worry, we'll just refresh and we'll come back. If you listen to the podcast, then I will have edited out all of the mistakes, so it should be fluid and lovely. So thank you very much for coming back, Lucy. You were with us how long ago was it now? I can't remember. I think it was episode 153.
Yeah, no, thank you for having me. Thanks for having me back.
It was an amazing episode. We got some lovely feedback because it's, as we're probably going to hear about now, it's such a personal story. And again, you're a classic example of somebody who's been through a certain situation which affected your life and those around you. And now you want to help educate therapists and other sports people to avoid potentially, give support where you weren't given support.
Yeah.
So maybe for people who haven't listened to 153, shame on you if you haven't listened yet. Could you give us a little bit about your history and how you got into specializing in this area?
Yeah, so I first came across the term relative energy deficiency in sport when I was actually looking for what I should do my dissertation on at uni. So we were just I was just trawling the internet, looking for things of what I should be doing my dissertation on, came across something called the female athlete triad. And as I was looking through symptoms and kind of the diagnostics of this, I was kind of thinking, I tick a lot of these boxes myself. I actually have quite a lot of these symptoms myself. So I started looking into the female athlete triad, and that was what I initially did my dissertation on in my undergrad. Was on the female athlete triad. And before this time, I'd never heard of the female athlete triad nor Red S before. I'd been at that point probably rowing for 10-ish years maybe. And that was my first year of doing anything sort of internationally within rowing. And so I'd rowed at a high level and never heard about any of these symptoms and never heard about what you should do if you have any of these symptoms. And then as I started discussing it more with some of my teammates, realized that actually a lot of them also had a lot of these symptoms. And as I was doing my dissertation and I came across more research about Red S, I then decided actually this is something I really want to know a little bit more about and research out, because the more I was talking to colleagues, so I was training to be a physiotherapist at the time, the more I was talking to colleagues and peers, the more I realized none of them really knew about it, including some lecturers. And then as I started talking more about these symptoms to my friends who are like the athletes, they also had never heard of this before. And I was like, there's a bit of a problem here, is that a lot of us are having these symptoms and a lot of us know that these symptoms are around, but don't really realize the ins and outs of what they're doing to our body or how this could be affecting us long term. So then I went on to do my master's at Oxford University on relative energy deficiency in sport. So I was kind of specializing in on that, and I was looking at the knowledge and awareness that physiotherapists have, which was pretty nil. And how this then can affect lightweight rowers, and look specifically at lightweight rowers because that was the sport that I did. So rowing in itself, you could do heavyweight or lightweight rowing. If you're a lightweight rower, you have to make weight. So what that means is that you weigh in 2 hours before an event. So it's different to boxing. You don't weigh in the day before. You don't really have much time to fuel up or hydrate. You weigh in 2 hours before your race, and you have, so for international weigh-in for women, it's 57.0 kilos, and for men, it's 70 kilos. And that's the crew average. So individually, that's what the crew average has to be. So individually, you could be 59 kilos as a woman, or you could be 72 kilos as a man. So that means that some people can end up taking weight for others. So even though I was quite light and already fit under that 57, I would often go a little bit lighter to help out some of my friends so that we could, as a crew average, make weight. So that obviously meant that we were dieting, we were restricting our food intake, we were restricting when we eat, we were training 2-3 times a day, definitely 3 times as we were coming closer into competition. So we were using a lot of fuel throughout the day, and we weren't necessarily getting in the right nutrition for this. And then what that caused was myself and a lot of my friends suffered with amenorrhea, so lack of or no period at all, so irregular periods or none at all. I did have friends who ended up having low bone density that started off at being like stress fractures, but actually then became at a young age, they were being diagnosed with osteoporosis, so having like brittle bones, which essentially is something that usually is considered as an older person's disease, if you like. But a lot of my friends were kind of suffering with these symptoms quite early on. So I first came about it from a personal point of view. And then it definitely became a sparked interest of mine to realize that this isn't right, that so many people are within this sport. I've been in this sport myself for many years, never heard of it or what to do if you get any of these symptoms. So it then has become like a real passion of mine to actually share the knowledge and awareness, because a lot of it is out there, but it's not necessarily accessible to everyone unless you're kind of in the academic world and you kind of have access to papers and things. It's not a readily sourced available thing that people talk about within grassroots sports, or even within like elite sports. It's not something that's commonly discussed very often. Thankfully now there's a little bit more knowledge and awareness, and even since our talk, I've had people that it's been started to be incorporated in more sporting situations, particularly in the rowing world. So it's good that the knowledge and awareness is starting to increase, but relative energy deficiency in sport in itself is a progression from the female athlete triad. The female athlete triad initially was found to be only something that women suffered with. It was kind of established in the late 1990s, which is pretty late in terms of how long these symptoms will have been going on for. And essentially the female athlete triad looked at a triad of symptoms, which was not having a period essentially, or irregular periods, not eating enough for how much you're training, and that then causing low bone density, so low energy availability, low bone density, and amenorrhea. Obviously, then the research has developed since then, and people have actually realized that it's not just women who can suffer with these symptoms. It could be men, and actually men are at a slight disadvantage because they don't have the early warning signal of their period not being present. So they then often come to clinics or start talking about some of these symptoms when they've actually got stress fractures, or when they've got low bone density, rather than it just being something hormonal that the body's not quite sorting out at this moment in time. But that was only recently been established in sort of 2014 as well. So it's very, very new in terms of people talking about this. But thankfully now a little bit more research is being done about it, and people are starting to talk about it more. But it isn't a sport. It isn't something that, whilst it's considered relative energy deficiency in sports, you don't have to be a sports person. You could be someone who goes to the gym regularly. You could be, people kind of have this umbrella term for athletes that you have to be training 3-4 times a day and working towards a specific sporting goal. But you could just be someone who regularly goes to the gym. You still come under a sports athlete bracket, and you may not be getting in enough fuel for how much you're actually training. If you're on your feet all day, if you've got a busy job, you're using a lot of fuel, even if it's not specific training. So it's something that any of us can suffer with, man, woman, young, old, sports, non-sports, anyone could suffer with these symptoms. And even if you're a lightweight athlete, so you have to make weight for a sport, there's an increased tendency for this to be of an occurrence, because you have that added pressure to make weight for your sports. But there could be other aspects that make you more at risk for this, that used to be like an old consideration, that the lighter you were, the faster you were. So that put an emphasis on people wanting to lose weight so that they were quicker at their sport. And obviously that's now found to not be the case. But some of these kind of ideas are still present within older coaches, or within sort of myth busting of sport in general. So it really can be anyone that suffers with these symptoms. And it's considered a syndrome. So it's not considered, a linear tendinitis, that there's a specific protocol that you should follow. Everyone is different, and everyone should be treated differently because of the symptoms that they present and the severity of symptoms that they present. But the main difference that sort of we would see as therapists is that you're not necessarily going to see people within a clinical eating disorder category. They may just have disordered eating patterns that are causing the low energy availability and the effects to their organs inside. What the main thing that I found from my research is that there was a lot of research already done in terms of how it can affect your body physically, but not necessarily how much and some on how it can affect you mentally, but not necessarily on how that can affect you psychosocially. And the problem with that is that can have such a long-term effect, because we found that people were struggling with relationships, struggling with as well as the physical and mental side of their symptoms. They were struggling with their life outside of their sport, so struggling to concentrate in schools, struggling to concentrate at work, struggling with relationships with boss, with family, with friends. And obviously long term that could then affect their longevity within a job, or it could affect the longevity within their relationship. It can put strain on family, parents, child relationships. So it's really something that we need to be trying to address early on, so that this doesn't become a long-term implication.
Right. I need to unpack that now. Hold on.
Sorry.
Yep, that's all right. I sorted it out in my head now. It was only 11 minutes. That's great.
Sorry.
No, there's so much because it shows, and your passion is beautiful about the subject. Obviously, now you've explained it's a place where you've come from with lightweight rowing. And that's probably, this, like you explained, you have to make weight. Is it 2 hours before the event? So it's pretty extreme. Like you said, it's not like boxing where at least, that's terrible as well in some boxers. But it is the kind of extreme. But you then followed it up with saying that it can happen to many, many people, even people who don't do sport. And this is the interesting thing, because your presentation in Therapy Expo is going to be what therapists do you need to know. And I think to start off with, what I want to talk about is there's probably a tendency for some massage therapists. I say massage therapists because there's a tendency amongst massage therapists to think, oh, we don't have to worry about that sort of thing, especially if there's an acronym. It's like, oh, leave that to the physios. Red-S, that sounds really complicated. I'm not allowed to deal with that. I'm not allowed to ask questions. And I think the fear of doing something wrong or saying the wrong thing becomes just, right, I'm not even going to look into that or pass them on. But I think the message I got from talking to you last time was, some of the symptoms you mentioned, they're probably going to want to come for an hour, lie down on a couch and just feel good and walk out feeling like the weight is off their shoulders. So there's an awful lot that massage therapists can do to help these people. Yeah,
definitely. I think particularly, especially if patients and clients are coming for an hour session, that's a really long time for you as a therapist to actually be allowing them the chance to talk, and you have the chance to listen to some of the symptoms. So a lot of what we might talk about in my presentation is like what you can ask and things, but it's not just about what you can ask the patient, it's also what you can gain from them talking. And having an hour with a patient or with a client, you're going to get a lot more rapport with the patient, and especially through the actual fact that you're touching the patient and they've built that rapport to actually build, they can trust you. They're going to trust you to talk about other things that they may not feel comfortable to trust to talk about their coach or to the doctor, because they're kind of in and out in 10 minutes. They've only got a quick 10 minutes to ask about one condition. It might not give them the chance to kind of delve as deep as they may end up actually talking to you. Even it might just be subconscious. It might not be a conscious decision that they are openly admitting to some of these symptoms, but they might just kind of say it in passing comment that they haven't had their period for a while, or they're really struggling with reoccurring injury and illnesses. And just noting some of these things in your head, you can then come back to it at a later date or refer on if needed to. But I think that it's definitely, being a massage therapist or generally working with them in a sporty environment, you often do have that first port of call. They may have gone to you before they've gone to someone else as well. They might not recognize it as being an injury or to being an issue. Even when I had some of these symptoms, I don't really care that I didn't have a period for a year. It was quite helpful for my sport, and then I didn't have to worry about that. So it's not something that people always register as being a problem, but they may end up start talking to you about some of these things just because they have that rapport, they have that one-to-one connection. They might have seen you for many years or many weeks. They might have, you just might have a different relationship with them to someone who they see as in more of a clinical setting where they feel like quite nervous to talk about situations and what that can kind of lead on to. It's usually more of a relaxed environment where you actually might be the first port of call of this person actually opening up about it. And as soon as they open up about it, it's not that you need to suddenly jump on them and start delving into and diagnosing them with RED-S. It's using that as an opportunity to kind of break down that barrier and discuss a little bit further, and kind of maybe prompt them to talk to someone else about this if you don't feel comfortable. The key thing with this as well is that whilst we need to be aware of these knowledge and symptoms, you don't need to know everything. And if you don't feel comfortable talking to the patient about this, if you recognize the symptom that they've discussed, that's great. That's the best thing that you could do for them. You can then refer them on if you need to. You don't feel like you need to take the weight of their life onto you. You can refer on if you need to. But just making them aware that they actually did mention that can be quite important and quite empowering for the clients or for the patients themselves as well. And also just, if they're booked in regularly with you and it's a routine thing, just monitor these symptoms, because obviously everyone's different. Sometimes people go through waves of cycles with different things. So just monitor these symptoms. If you know that they're booked in regularly, note it down as something in your notes, then just come back and see if they talk about it the next time, so that you can delve into it a little bit deeper and like I say, refer on if required. But I think as a therapist, you're more likely to have that one-to-one rapport, and also more likely to see them in the earlier stages, which is when it's so crucial that we can actually try and nip this in the bud before it becomes an ongoing issue, before they actually feel that they need to go to a clinical setting, because they might not feel that the symptoms of a reoccurring injury is a doctor's problem. So it's a really important and empowering position that you're in to actually have that long time. An hour is a really long time for someone to actually open up about themselves. So I'd just use that to your advantage and make sure that you're allowing that space to do so. It's important to ask questions, but it's equally as important to listen and to hear what they're saying. Brilliant.
We like that. We like every time we hear that, bells ring. Two ears, one mouth sort of thing. But that's, what you said is so true. And I think that should empower massage therapists. And really, it's the future business model. I always think like in Canada, for example, and probably some other places, massage can be used as insurance. Insurance companies will pay for it because there's a separation between the kind of spa clinic massage, which is lovely and great, but then the kind of more leaning towards part of healthcare massage. Because of this reason, I think. And if massage therapists out there start asking these questions and forming a really important part of signposting people to go and see specialists, that could be a really important part of the chain of care, couldn't it? Just
especially if they, like with RED-S athletes, as being an athlete, if they are an athlete, like I say, it can come from non-athletes. But if they're an athlete, they're going to want to have the extra 2% with everything. They're going to want to be making sure their nutrition's on point. They're going to want to be making sure they're sleeping on point. So massage will probably come into part of their training package and part of their sort of wellness management and looking after them it might be considered more holistically, but looking after them less sort of clinical in terms of their routine rehab or their routine training. It's just something they do to kind of make themselves feel good after training and kind of tick everything over, which is why you probably will see them more often. And so I do think it's really, really important that you just are able to recognize these symptoms. And like you say, you can use this to empower your situation to actually so that everyone knows the importance of your situation and the importance of your job role, and how you can be of value to the wider healthcare. You know, we're all sort of an MDT. It can be, even if we all work individually, everyone can kind of refer in and out. And, you know, it's so important that we have massage therapist for this reason, because you are touching the patient, you are going to have that one-to-one connection. The key thing to note as well, though, is that you're not necessarily going to see red S on a patient or reds on a patient. They're not necessarily going to look a certain way, have a certain build to them. It's not as physical as some sort of eating disorders may typically present. So it's not just how the patient looks as they walk in. It's you know, seeing how their muscles feel as well. You know, if there's a lot of reoccurring tightness and a lot of reoccurring tension, that could be an underlying situation for something going on. It could be an indication that the tissue is not quite healing. So it's not necessarily how they present and how they sit down in your clinic to you. It could also be how they are on the massage bed.
That's a really good point. And actually, I had an email, thanks to a couple of photos I shared with your permission last time. One of the things which really caused a couple of emails coming in was when they realized that somebody who looks fit, I think I said on the actual podcast last time, ripped, I think was the word I used. They come in looking like, you know, male or female mountain, and actually they could still be suffering from reds. And we got a couple of emails saying, oh, that was so enlightening, because you always expect them to be frail and kind of like delicate. So let's just bring those photos up again, shall we? So a little bit of reading back for you. People listening to the podcast, you can't see these photos, but if you want to see them, then just pop along to YouTube, Sports Therapy Association channel, and you'll see them. So there's two pictures. This is just you. Talk us through, this gives people a nice idea of what lightweight rowing looks like. Guess what? It's people in a rowing boat. But where was this? This is your gold this
was at BUCS. So this is British University College Sport. It's what most universities train towards every year. So this was our BUCS regatta. So we have a BUCS head event and we have a BUCS regatta event. So this was when I was at Nottingham University, and we won in that year. We won in the lightweight 4, the lightweight quad, and then we got a silver, I think, in the double. So we did quite well overall in the BUCS leagues. That's kind of like your national university league. And before each of these races, so it was a 3-day event, and you had to weigh in every morning. So it wasn't just that we had to make weights on the Friday. We had to make weight on Friday, Saturday, Sunday. You only weigh in once for the day. So once you have weighed in, you're confirmed, you're kind of good to go for that day. So we did have 3 races each day as well. So we were racing time trial in the morning, you'd have a semi-final, then you'd have a final in the afternoon. So it was a lot of racing over the weekend. And because we had to make weight for each of these events, you know, the nutrition sometimes did lack. And one of my friends in that picture, she would be, you know, literally just having chocolate milk for the day, and that was it, just to make sure that she made weight for the next day. And it was less about the fueling for that day, and it was more about making it through. And something that's quite important to know is that even though we did so well in some of these events, we didn't have periods. There were things going on internally that our body was saying that wasn't happy, and things weren't ticking along how they should be. So in this picture again, this was our varsity. So this was Nottingham University against Nottingham Trent. So we'd won, we'd done really, really well. We all look very physical.
Yeah, if you're listening to the podcast, I mean, we've got 12 double bicep poses here going on, and we've got Lucy in the middle with like what can only describe as at least an 8-pack. And it just looks, I mean, this was the photo that generated the emails last time. You all look super fit. If any of you walked in to see a therapist, the last thing I would think is that you had some kind of energy deficit thing going on. It looked like the opposite. No. Yeah. But like you're saying, people in the last photo, maybe in this one, were actually struggling. And in your studies, it was so fascinating hearing when you did do telephone calls with past athletes about how much people were scarily suffering in their personal life.
The problem is that the low energy availability doesn't attribute to how you look physically. It's not that you're, like say, super frail or it's not an obvious symptom from the outside, because it's what's going on internally. And it's similar to kind of like your fight or flight response. We were still excelling in our sport and still doing well in our sports, but it was kind of like the fight or flight system, that our body recognized that it needed to send the right amount of signals to the muscles so that we were able to perform for the sport. But it started switching off some of the other signals to our internal organs, like our reproductive organs and systems like that. So it's kind of like similar to like your phone, like when your phone goes on low power mode, once you click low power mode, your data will save to like WhatsApp if that's what you use regularly, and kind of turn off the data to Instagram if you're not using that as regularly, and it will kind of filter it to what you're using most often. And that's similar to what happens in our bodies. Some patients, some athletes may be excelling in their sport, and that's like often the hardest time, is that they might be world champion, they might be doing the best thing ever. And so in terms of on paper, they're the best athlete, they're the healthiest they could ever be. But actually, internally, their body might have gone into low power mode. They might have gone into that fight or flight response. They might be excelling in their sports, but things might not be excelling outside of sports. So it's just key to know that it's not something physical. And like, yeah, I did have a six-pack. I had an eight-pack at the time, but it didn't mean that I was physically healthy. It's that wasn't necessarily what my body should have been like at the time, because I didn't have a period at that point. So, that was an obvious early warning sign. I didn't realize it was an obvious early warning sign that my body was not quite ticking along how it should be.
And also, I guess it's also in the heat of the moment, and you're all there and you're all feeling great, and the adrenaline and everything, and it's when that person goes by themselves, when all that's over, and you're trying to go home and you're realizing you're not meeting up with any of your friends, maybe, or you're not getting on with your family, or maybe you're being sick after you're eating because you're worrying that it's not quite over yet. And then you go to the therapist, and it's like, I mean, when I think you mentioned it, some of the symptoms, imagine anyone out there who's let's say massage therapist or a sports therapist who does some massage and stuff. Someone comes in and they are complaining about being really tired. And you think, oh yeah, that's because, you're an athlete competing. That's normal. And then maybe they might say, oh, I'm finding it a bit difficult to recover. And you say, oh, you're just overtraining a little bit. But unless you ask the extra questions, like, have you got any menstrual dysfunction, or are you losing any muscle recently or something, then you would never know, would you, that this person actually needs professional help from a specialist.
It's really important to note that these symptoms, like even like what we were just talking about, the psychosocial aspect, that's something you can't see physically, and it's not something that you're automatically going to ask a patient as well. So that is something that you're only going to find those questions out with someone if you have that rapport with them, and if you've got that long appointment time to actually discuss some of these things. So because it's not going to be the first thing they walk in with. If they're coming to any sort of therapist, myself including being a physio, they're not going to suddenly walk in and say, oh, I'm struggling concentrating at school. It's not the first thing, because that's not what they associate being our jobs as being to talk about. So that type of conversation would just come up when you're discussing, school life, work life balance with them. But it's really important that we do note that it's not just the physical and the psychological symptoms within these patients, it's the psychosocial aspect as well, that long term they could be more detrimental if we don't enable people to look at these symptoms. Because if someone's losing their job over not concentrating and not then performing in their work, but they're still doing great in their sport, great, that's fantastic about their sport. But if they've not got an income in, they might not be able to fund that sport. So it does have such a knock-on effect. The problem, like with my own family, for example, was that my parents were saying to me that I had like calorie Asperger's, that I was like obsessed with telling them what was in the calories for different things. And it was putting a strain on, me and my family had the best relationship. We're all so super close, but it was putting a strain on our family relationship, because my parents were trying to sit me down and say, like, this is becoming a problem. And I was like, you don't understand. I'm an athlete. I don't think I look fat. It's nothing to do with how I look. It's nothing to do with how I feel. I'm doing this for my sports. I'm healthy. You don't understand. And that was putting a strain on our family relationship, because my parents would have like for example, on a Saturday night, they wanted to have a takeaway when I was home from uni. And I would say, no, I cannot eat that. I'd go and make myself like a quinoa salad bowl or whatever, because I was so obsessed with making sure that I had little calories for that day. And I was so obsessed with not eating anything out of a can. Everything had to be homemade, which is lovely. But I wouldn't even have like tomatoes out of a can or anything. Like everything, I wanted it to be pure. And so it can cause disordered eating, and then left to it could cause eating disorders in itself. But it could stem initially from, like we're saying, red S, but also that strain on relationship at home. Thankfully, obviously, my family and I have a really close relationship. We were able to sort it out, but some people may not be in that situation, and it could cause a long-term problem for some of these people.
If you during that time, I'm interested, during that time, did you like you said, for example, no periods for a year. During that time, was that challenged at all by any GPs or any
Mhm.
physicians or any? Just didn't happen.
No, so unfortunately for myself, the only time I did mention it to a GP was at the university, and I think I mentioned it in a passing comment when I was there for something else, and they then said to me about going on the pill, and that was the response to it. And that unfortunately is a common response to when girls say that they're struggling with periods or irregular periods or heavy periods. But the answer from a lot of GPs, not all, but a lot, can often be go on the pill. Now, unfortunately, going on the pill doesn't solve the problem. Having a bleed on the pill is a withdrawal bleed from the pill. It's not actually a period. So you're still masking the problem. You're just putting a plaster over the issue. And someone may still bleed and think they've got the period, but actually just being on the pill and having that withdrawal bleed isn't a period. So they may still have these fundamental issues going on and these fundamental psychological, psychosocial, physical problems. And at the moment, we're just masking it with being on the pill. So that was the only time I ever brought it up, but no coach ever asked me about it. And I think that it's really important and really empowering for coaches, for therapists, but to just be a normal topic of conversation. We're not like back in the day where people were kind of nervous to talk about these types of things. It's something that we should openly be able to discuss and ask patients, athletes, coaches, be able to talk to athletes about it, and without feeling nervous or ashamed or embarrassed about it, because it's a really great indicator for girls. Like I say, we've got one up on boys actually having this, because if that system is not functioning as it should, it's an early warning indicator that things aren't quite moving how they should do in the background.
That reminds me, just remind me of the wonderful Michelle Lyons, who's going to be speaking at STA Theatre as well, and is also really keen to speak to you. She was talking about how there needs to be a re-education where menstruation is seen as the power instead of the curse.
Mm-hmm.
Actually, if tip it on its head, if you time things properly, you can
Yeah.
turn this into your favor and
Yeah.
actually get perfect training. And like when you said it, we've got one up on the boys.
Yeah.
Whereas at the moment, I get the impression it is seen still as the curse.
Yeah.
Where it's like, oh, I can't do this and can't do that. So.
And there are certain cycles within girls that training in your follicular phase or your luteal phase will affect your recovery, and you have different muscle in that time because of your estrogen levels. So depending on the time of the month, it can increase your risk of injury, it can increase your risk of illness, and it can reduce your recovery rate. So as therapists, it's good to know this, because it might then change how what type, if you're giving exercises to people, it might kind of change what type of exercise you give them and when. And by having these conversations with them, it also makes them understand the importance of recognizing their own sort of period cycle, so that they know that they may not feel great on a race day, but or a competition day, but they can do things to kind of support that by maybe not doing a heavy strength training that week, and doing more stretching, because actually that's what their body needs. So it's really important as girls to like I say, empower this conversation, so that we can talk about luteal phase, follicular phase, and understanding how that can stimulate your training and how that can be a foundation to our recovery with patients, and how we can make sure that we're best looking after our system in a whole. So it's really important that we break that stigma.
And in your experience, so for you, it was like about 4 or 5 years ago when you were competing and this was going on. I mean, you're in contact, I think you work closely with quite a lot of clubs and things. Has it changed a little bit? Or are you still seeing kind of younger versions of you going through the same thing because they're not being supported by coaches or GPs or?
Unfortunately, there is still a common theme that I do get a lot of people in with these early warning signals, but parents don't realize that this is a problem, and they don't also realize the importance of, especially like this time of year for us, going back into September is where we get so many kids in with injuries, because they've not done much over summer. They might have been on holiday for 4 weeks or whatever, 6 weeks. They've been they might have been on a few like football camps or different things over summer, but they've not really trained consistently. Then as soon as they've gone back in September, they've gone back to cricket, hockey, dance, swimming, netball, like so much in one week and so much in one day. And they're not necessarily getting in the fuel they need in between that. They've not necessarily upped how much protein they're having. They've not necessarily taken into consideration like the age of the child as well. So how much they're growing in that time, the importance of sleep and hydration, nutrition. And so we see a lot of patients during this time, unfortunately, that do have stress fracture injuries, that do have low energy availability, just because they've suddenly had a peak and a spike in their load of activity. And it's also making the parents aware that, as adults, we wouldn't expect ourselves to run a marathon after no training over summer, and then suddenly 3 weeks into September you're running a marathon. You'd say, no, that's ridiculous. But the load that's put on these bodies as an adolescent or even younger is essentially the same as us doing a marathon without any training. You're suddenly putting yourself through loads of stress during the day, carrying school bags, carrying heavy rucksacks, you burning a lot of fuel throughout the day, and then also going from swimming, hockey, netball, whatever it is throughout the day, and not necessarily getting in the fuel. So it's important that we are able to talk to these patients' parents as well about educating them on the importance of fuel and nutrition in and around their sport, and making sure that they use the window of opportunity after sport to get in protein, to get in fuel that they may have been burning throughout that day, to reduce the risk of injury and illness. Because we do still get a lot of I do still get a lot of patients with RED-S, whether it's been a diagnosis or whether they've kind of started off with early warning signs. Often I get a lot of patients coming in with an injury, but then, as we discuss a little bit further, the injury is stemming from something more whole, like RED-S. And I think it's also important, whilst talking about RED-S in itself, is that there is which I will talk about more in my presentation, but there is the �RED-S-𝐶at tool, it was published by Margot Mountjoy a few years ago. And that is a tool for clinicians, it's a tool for coaches, it's a tool for parents. You don't have to be a physiotherapist or a doctor or someone with a medical degree as such to actually use this as a tool. And it's essentially to know when your athlete or when your patient is ready and fit to return back to sport. And it's basically a checklist. It's giving you like a traffic light system. You don't have to be anyone with any RED specific qualification to use. It's quite self-explanatory, and you can just follow that to make sure that you're guiding your patients. You could give it to them if you don't feel comfortable talking to them about it. You could give it to them and they can make the assessment if they wanted to. It's better if it's guided from someone else, because there might be a bit of subjective bias going in if it was left to the athlete themselves. But it is something that anyone can use, and a massage therapist could also use it. It doesn't have to be someone who has a specific RED-S qualification or has done specific RED-S research. So I think that's also important to note, is that with all these patients that we do get in, is that that's a tool that I use to make sure that we are looking at these patients holistically and looking at their safe return to sport and guiding them in the effective way. And even if you're not necessarily establishing a rehab program for a patient, if you are purely seeing them for a massage, if you bring this as a topic of awareness to them, they can then take that to their coach, and their coach can use
Brilliant.
it with them. So
And that's something you can download. Well, we can put a link for that in the notes. It's something that's very available. And oh wow,
yeah.
You didn't tell me about that last episode, did you? Holding something back.
No, I forgot to mention it, and that's why I thought I need to make sure I mention it, because I end up waffling about RED-S a lot because I end up just talking a lot about it, and I need to make sure I mention points.
Well, this is the thing. There's so much we could talk about, but no, this is amazing. I think also in the back of my mind, I think we've shown now that potentially a lot. We haven't even touched on the guys yet, and that's something. Well, 8:38. We could pick up with later on, but even if we just look at the females at the moment coming through the door, I'm hoping that therapists of all different types, whether it's massage or sports therapy, sports rehab, will realize that maybe they've missed some of these, and we've got these people coming, they haven't asked the right questions, they've made that misassumption, this person looks really ripped and healthy, but they haven't asked the questions about the nutrition and how they feel and what their relationships are like and all that sort of stuff. So, but then I think it's interesting as well, and you mentioned this last time, and it had quite an impact on me, about dividing these people up into accidental and intentional. We've sort of mentioned it a little bit, but could you, what does that category mean?
Yeah, so intentional, unintentional weight loss is essentially, and this could be someone who's intentionally or unintentionally fueling themselves for their sport. So essentially, intentional weight loss is like, for myself, I was trying to lose weight in order to make weight for my race. So that could be someone who is a jockey who's trying to make weight, a boxer who's trying to make weight, lightweight rower, for example. That there are lots of different sports that there is a weight element to their sports. So in which case they may be purposefully underfueling themselves or underfueling their training, particularly building into that day in which they need to rate until they need to make that weight. They may also be doing other types of weight loss, like colonic irrigation, which is sometimes encouraged by sports. So essentially flushing everything out, going for sweat baths, sweat saunas, really just trying to get rid of any water weight. So that's real intentional weight loss, a real intentional underfueling. But that, like I say, even when I was going through that sort of intentional weight loss, didn't see it as a problem, because for me, I was doing it for sport. I wasn't doing it for how I looked or how I felt. So for me, it felt healthy, not healthy. The unintentional weight loss or the unintentional underfueling is often that young athlete or young patient who is going from sport to sport to sport, who doesn't necessarily realize that they've actually had a very light breakfast that day. They might have just had a banana because they were late getting up for school, and then they went to school all day. They've been on their feet all day. They've already had a rounders at lunchtime. They've been out playing football in the break time, and then they've got swimming after school, and then they go straight from swimming to hockey, and they've actually only had a sandwich for lunch, a banana for breakfast, and then they're going to go home and have a chicken curry, for example. And actually they've not really got much fuel in throughout that day, but they've burnt a lot of fuel, and that can cause unintentional weight loss or unintentional underfueling. So it's not necessarily that they're doing it for a sport, but just because of time or just because of where they're training, they may be unintentionally underfueling themselves. So it's not, like I said, that's why it's not always the specific athlete that you think about. It's more about what they're doing. And I often literally break it down with them like a diary, like when just taking notes and things, just say, so what do you get up to? Take me through your week. What do you usually do during the week? And just get them to have a bit of a chat about, so Monday they do this, then Tuesday they do this. And you can often see a bit of a theme coming into, and obviously depending on their age, if they're 15, they might be going through GCSEs. If that their age will then determine kind of what they're also doing during sports. And I often talk to them, so what also do you do about what are you doing during PE? And then they talk about all the different sports they're doing in PE, which is great, but then they're not actually getting in any fuel in between that, and they don't really like school dinners or anything, so they have a small dinner at lunch. So it's then making them and the parents aware that we need to look at this, and potentially taking in smoothies, taking in extra chicken and rice bowls, and things, just getting in protein and fuel in other ways throughout the day to make sure that we're actually fueling ourselves for all these sports and for all this energy that you're using throughout the day. So it's important to recognize that there's intentional, like I say, trying to make weight for a sport or trying to lose weight for a sport, or unintentional, which is essentially training a lot without realizing you're not getting in enough fuel for how much you're actually training or exercising. And it doesn't have to be specific training as exercising. Walking throughout school is still a form of actually burning fuel and still a form of actually activating all your muscles. So yeah.
Excellent. Yeah. No, I think it's really useful to therapists to bear that in mind when they're kind of like categorizing potential people.
Yeah, and it can be any sport, like we say.
Yeah, and so that's when suddenly the penny drops, and you could think, right, this low energy might be a sign of that. You also mentioned that you're losing maybe muscle, inability to recover. Then the period question might come out again, and that might reveal itself, and also re-injury, stress fractures. So once. Let's imagine a massage therapist has identified this, and they've had a real big heart-to-heart. And massage therapists, generally, when I train massage therapists, when I used to, we let them know there's probably going to be some crying involved, because it does happen. You know, people do, once they release that holding that system and they let it go, you get people crying. And I've had some incredible admissions from clients who have talked about their family situation, relationships, children, deaths, all these sort of things, simply because they've had a massage and they just felt, oh, I need to do it. And they're sitting there, and you need to know, do you need some time by yourself? What do you do? But let's imagine that's happened, and you have referred that person on now to a Red S specialist, or well, first of all, who should you refer them to? Is it go to the GP first of all, even though you're a bit wide, the GP is going to say, I
would recommend, I mean, it depends on the patient situation, whether they've come to see, do they see, do your type of therapist see anyone on NHS, or is it all private work?
No, it's all private.
Private, fine.
Let's go. Well, not all of it, but most of it, especially for massage therapists. Yes.
Fine. So I know obviously everyone's financial situation may be different, but if they are able to self-fund, or if they have any private health insurance, I would recommend seeing a sports medicine doctor who kind of looks at everything more holistically and kind of incorporates everything, rather than just sending them back to the GP. Unfortunately, at the moment, with how that may work, they may have to wait a long time, and they may not actually get to see their regular GP, so they may not have that rapport with them. But going to see someone like a sports medicine doctor, they're more likely to have an awareness of these signs and symptoms as well, whereas a GP may or may not have awareness of these signs and symptoms. So I would first of all try and get them into a sports medicine doctor. Can also then refer to someone like myself, someone who specializes or works with patients with REDS or RED-S. Nutritionists can also be important. It depends on what signs and symptoms you're recognizing. If you recognize that they're getting a lot of there's a lot of psychological issues going on, then I would initially recommend them to go see a sports psychologist or a psychologist initially, just to kind of start that ball rolling. but make them aware that there would be a kind of an MDT situation that would be best for them to manage this situation. So if it's more you're worried about their nutrition, then again, refer them to the nutritionist, dietitian. If it is more they're having these reoccurring injuries and things and reoccurring stress fractures, get them into a physio. If you're wanting someone to look at it overall, though, that's where I'd say the sports medicine doctor would be the one to go to first, because they can then make the appropriate MRI scans to see where bone stress fractures are or are not, make the appropriate blood test referrals. So they're looking at vitamin D levels. So initially, a sports doctor, unless you think that the psychological or the nutrition aspect is something that needs to be addressed sooner. I think a lot of this also depends on time, as well as who can they get in with sooner as well, unfortunately, at the moment. So if they can get in with someone, get them in with them first, get the ball rolling, and then get everything else in check later on. But in making that initial first acknowledgement of these signs and symptoms will then help them to kind of put things in place. But like I say, you can then use, if you want to, you could then use that 𝐸𝐴𝐷𝐾𝐻 tool to kind of know how to kind of manage them if they're just wanting to see yourself. So yeah.
Excellent. And I guess, and this has been said quite a few times, whether you're dealing with a patient who needs to see a rheumatology specialist or hypermobility or whatever it is going to be, endometriosis, once you've got that connection with somebody who knows your name and you know their name, then that's all you really need. And they might not be able to help this person. They say, yeah, I know somebody in wherever who can help them. So it's just massage therapists, I said this a few times, should really have quite a big black book by now of names of people who they can send people to, female pelvic health specialist, male pelvic health specialist.
And if you don't have anyone locally, like I've seen patients remotely, like although it's not ideal, you obviously want to get people in face to face if possible. But if people live, I'm in Cheshire, but if someone's in London but wants to have a conversation, we can do things virtually. So if you initially, and then I could then maybe potentially, I might know someone in London who I could then refer them back to, who they could see in person. So even if you can message someone, if you really don't have anyone that you know you can refer to, look on social media. Social media is such a great, powerful tool that we can use: Twitter, Facebook, Instagram, whatever. Try and find someone who you can have a little quick conversation with. Obviously, don't disclose any personal details with them about the patient, but just say you've got a patient who you'd like to refer them to, or where should you go to next. Just speak out. Don't feel that you have to kind of bottle this all up in your own clinic room. Just make sure that you're kind of reaching out for advice from others, whether it be through social media or whether it just be through a specific referral. If you are obviously doing it through a specific referral, you can use the appropriate chains for that. If you are doing it through social media, then just maybe don't make sure keep patient confidentiality until they are the patient of the other person.
Definitely good advice.
But you can initially reach out to them and just say, what should I do in this situation?
And as Gary's pointed out, Gary Benson, founder of the STA, is in listening live. And Gary Benson said, if we don't have the knowledge on where to refer onwards, the STA have a great team who might be your first port of call and can signpost you further. So yeah, this is where it's an advantage. Your professional association, especially if they do a podcast and have got 167 guests with specialities and different things, just approach your personal association, professional representation, and say, look, I've got this client and blah, 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 with confidentiality. Who should I send them to? I say, Lucy Gillbanks. Just send them. Fine. That's your portal call. So you can do a virtual consultation to start it off. So I'm interested then, have you got, I haven't given you a chance to prepare for this, but what I'm interested in now is, have you got any examples of patients you have seen, or maybe colleagues have seen, who didn't realize that they were suffering from red-S, and then they've been down the channels and they've come out stronger, healthier and better? And give me, maybe does anyone come to mind, or any?
I mean, including myself, when I had these signs and symptoms and things, initially, if it had been left, it could have been something that kind of stopped me from doing sports and things. But actually, I was able to then, once we kind of address this situation and realize it's a situation, and make sure that you kind of get like periods and things in check, and get the physical side of things sorted, get the psychological things side sorted, get the psychosocial things side sorted. I was then able to go on to Oxford University and be like part of the Blues team to work within the boat race team. But had I not established what was going on a little bit earlier on, I may have had to retire from sport. A lot of people within lightweight rowing specifically had to stop sport early on because they didn't recognize these symptoms till it was osteoporosis or something more significant that actually they couldn't carry on with. So if you identify these things earlier, then yes, you can have a great outcome afterwards. You can carry on doing your sport. You can excel in your sport. I had a patient obviously keeping confidentiality. But I had a patient who initially didn't realize this problem. Once we then actually addressed the problem, got the right management on board, they were then able to go on and represent their country within their sport, able to go to world championships within their sport. But had we not identified it early enough, they may have ended up going down the other route and actually had to stop sport altogether and just stick to kind of no weight bearing sports, because of the fact that they were a young athlete with osteoporosis now, and they had to monitor what they were doing to reduce the risk of fracture. But yeah, no, so I did have a patient who had these signs and symptoms, didn't realize it was a problem. It was a long 2 years of actually getting things sorted. So it was a long time with this person. However,
intentional or non-intentional?
Unintentional initially. But then, long term, we're able to get this sorted. So there was intentional changes that we're able to make, but unintentional cause for it to begin with. But this person was then able to go on world championship level.
So even if you're going through, let's imagine somebody who's had a couple of repeated stress fractures and that's keeping them out of the game. If you address it and you find the correct reason that's causing this, and you address it with some time and therapy, then you can come back. And it's not a long-term. I mean, like for example, with amenorrhea and that, if it's treated properly, it can come back. You don't necessarily lose fertility and everything. So it's not a full-term systemic issue. You can recover and come back
if things
stronger.
Like this are identified early enough, we can establish the problem, establish the root cause, not put a mask over the problem, establish the root cause, treat the root cause, not treating the symptoms, making sure we're treating the cause and getting that patient back to full fitness and back to their sports. You can, even though there's a lot going on with RED, it's the same as like an ACL. If someone's ruptured an ACL, it's not that they're never going to play sports again or they're never going to ski again. It's just going to be a long rehab process to actually get them back to where they were, to get full fitness and to get everything sorted out. It's the same injury wise, it's the same illness wise. We just need to get everything ticking along inside so that from the outside they can perform to the best of their capability.
Amazing.
So yeah.
And imagine if you, not you, but imagine if you, the listener, were the humble, non-assuming massage therapist who identified this and formed part of that care. I mean, your reputation and your business is just going to boom, and also you're going to start getting referrals from other people in that chain, and they go, wow, I'm going to send my athletes to you because I know that you've got your eyes and ears open. And
just knowing that you're looking at other things rather than just going through the day-to-day of treating patient one in, one out, making sure that you're looking at every patient individually. If you recognize these symptoms in an athlete or recognize them within the parent's child, the child and the parents, that they will then also acknowledge you as someone who's looking at them as not just a number on their caseload that day. You're looking at them holistically, and you're looking at how you can better them within sport and not just kind of get them through that week. So it's really empowering that we use our position at whatever level you're kind of treating patients at to better them within their sport and help them long term. Because if we do leave these and we do kind of let it simmer away, and then they go off and do other sports and things, and we've never identified that with a patient. Like I say, sometimes these patients aren't really aware that it's even a problem, but if you let them know it's a bit of an issue and let them have that opportunity to discuss it with you, then they can prevent this from becoming a long-term issue. Whereas if they do leave like their periods and things, then they may end up struggling with having children in the future and having fertility problems. They may end up having brittle bones when they're very young. They may end up pulling out of sport because they've just got reoccurring illnesses, because their immune system is just so compromised because of years of underfueling. But if we identify it early enough, we can give everyone these tools to stop that long term. So it's really not looking at them now, it's looking at them in the long term as well.
Amazing. And we could have another hour conversation about, as well as the systemic issues, you've got the psychosocial factors of the depression, anxiety, and potential suicides and all sort of things, which could...
And that's where massage therapists, it's going to be really important for them to be able to have that conversation with you, like you said before, because they are going to have that cathartic release. They probably are going to talk to you about things that they may not talk to other people about. So they may open up about more of those psychological issues that are going on. And even if you don't feel prepared to talk to them about them, if you identify them as an issue, find a psychologist or a sports psychologist who works locally, who you can refer them to, so that they can then take the baton on from you and discuss that further with that patient. You don't have to take everything on yourself. It's as much of an empowerment to recognize these symptoms and refer out and know your own limitation as it is to actually try and help all of these patients, because not everyone can individually help everyone. That's why we have multidisciplinary teams. So just make sure that you're referring out if you don't feel comfortable with the psychological, psychosocial, or physical symptoms, any of them. Refer out, speak to someone will be able to help them.
Brilliant. What a soundbite that's going to be. That's incredible. I feel empowered. So yeah, I mean, I want to give, right, let's hear it for the boys. I want to have like 3 minutes just for the guys, because
Yeah.
I mean, it's obviously the menstruation, like you said, it's a clear indication. Is there any data on how many guys are unknowingly kind of doing this intentionally or non-intentionally?
Well, there was an overall stat from the IOC, and that was for the last Olympics, that 70% of all athletes, men and women, had at least one symptom of red S. So 70% at the top level had a symptom of red S. So that was men and women. And unfortunately, particularly within my studies as well, that I found is that some of the men actually had more of the kind of long-term situations going on, the reoccurring stress fractures, the reoccurring illnesses, the kind of compromised immune systems, because they didn't have that early warning signal. So often with men, the stat is actually finding that they're getting more of the physical and the psychological aspect, the psychological symptoms. The psychosocial is the same for both men and women from what I found within my study, but the psychological symptoms, the men I found were struggling more. Because as well as obviously the physical symptoms, they also felt that they didn't necessarily feel that they could speak out about some of these things. So that's then kind of bringing into the mental health stigma that a lot of men still feel under, is that they feel that girls might talk about periods, might talk about these types of things, might talk about their mental health or how they're feeling that day, but for boys, they kind of need to just get on with it and have a stiff upper lip and don't cry, don't have emotion and things, and just get on with things. And actually that was then causing a lot of emotional burden for a lot of the men that I spoke to, a lot of the lightweight rowers that I spoke to, and that they felt quite depressed about the situation because they just didn't know who to turn to. They didn't have that early warning signal, so they didn't have something that they could kind of break that first initial barrier with, to say, I'm struggling with my period, I'm struggling with this. They just didn't have that as an early warning signal. So that's where, again, the massage therapist is going to be really important to have that one-to-one rapport with, because they may then actually start opening up to you about some of these symptoms that they may not be able to discuss with other people. So it was more on the men, as well as the physical, psychosocial. It was more the psychological symptoms that they were suffering with, because they didn't have as many of the physical symptoms that came initially. And when they did, they were often quite progressed on, and they wanted to just try and crack on with it and ignore them. So yeah.
Amazing. There's such connections going on, like, because the big takeaway that was for me was like mental health, and we know that men are more susceptible to suicide because they're not opening up and talking about it. And you've just said that because they don't get the early indications, for example, of ceasing of periods and stuff, then they're more likely just to put up with it and make even worse the psychosocial effects of it. So, and it all ties in, because like at Therapy Expo, we're going to have, that's why we're having Jack Coward and Ryan Smith talking about mental health for men with their podcasts and everything. We're going to have, as you were talking, you mentioned like suppressed immune system, and that was Lucy Williamson from last week talking about the systemic effect of poor nutrition on the gut microbiome. You know, so it's amazing. That's what excites me so much about Therapy Expo, and the way we're putting everything together is it's all connected, you know. It's all a Venn diagram with all of you wonderfully just working together, and the knock-on effects, and that's how healthcare has to be. So
but I definitely think that I would definitely almost suggest that you probe the men more without being too stereotypical, because they may keep a lot of it to themselves. Some of the girls may end up opening up a little bit too as you get talking about different things. It may be easier for a female and a as in the same sex to be treating one another. They may feel more comfortable opening up to yourself. If you're of the same gender, they may feel more comfortable of a woman talking to another woman about their period. But being able to have this conversation with patients and breaking that stigma down. The same with if I have a male patient, if I start talking to them about it, they may feel uncomfortable initially, but if I make them aware that I'm not uncomfortable talking about it, then it can hopefully help them to open up a little bit more as well. So even if typically they wouldn't want to speak to me about it, they may end up kind of opening up a little bit more if you start probing the questions to them as well. So don't feel that you can't ask these questions just because you're not a bloke and you can't kind of discuss these topics with them, because they might feel uncomfortable. If you approach the subject with them, it might then give them the tool to then take it away and discuss a little bit more, or like I say, refer on if you don't feel comfortable to talk to them about it. But if you recognize that there's an issue, then flag it up.
Great point. Really good. David, Faheti. I'm going to put that as the pronunciation, David. Forgive me if I've mispronounced your last name, but says great to have someone as knowledgeable as Lucy on the cast. On the cast, we're not a show. Yes, we're a show. On the cast, very interesting. Thank you. Yes, it is. It's great. It's been amazing, Lucy. Thank you so much. So look at the time. So for people who are interested, you're coming to Therapy Expo, or maybe you're thinking, should I go to Therapy Expo? What is this Therapy Expo? Then do come along. Lucy is going to be on day one, which is the 22nd of November 2023 in the NEC in Birmingham, UK. And Lucy is going to be presenting relative energy deficiency in sport, what therapists need to know. If you haven't been to Therapy Expo before, we're talking, I don't know, 5,000-7,000 people over 2 days coming in and out. Amazing networking, a real good buzz. And the quality of speakers has just gone beyond. Mainly or especially because they're just listening to all associations like Sports Therapy Association. Gary Benson's been part of the advisory team on what sort of speakers, what topics need to be, and they really are revolutionizing what an expo is all about, in that they're putting speakers forward who are just putting out evidence-based, evidence-informed information, as opposed to fads and selling things, which is always going to be there. But Therapy Expo really is, hand on heart now, such a high percentage of it is quality speakers now, especially in the STA Updates Theatre. So yeah, Lucy's going to be there, second speaker on day one. And then also, if you miss day one, if you're only going to day two, which is the 23rd of November, then Lucy will also be speaking in Theatre C, which, if I remember rightly, is 3:30. So you've got a double opportunity for everything and anything to do with relative energy deficiency in sport. So there we go. We're looking forward to it. It's going to be great seeing you all together. Really is amazing.
Thank you for the opportunity.
Oh no, thank you. So there we go. We are going to be back next Tuesday. If you listen to the podcast, this is recorded live every Tuesday on the Sports Therapy Association YouTube channel. Next Tuesday is a little bit different, actually. We're having a little, I'm sure Therapy Expo will get mentioned, but next week is going to be a panel discussion. It's something which messages were put out there on social media. It's going to be entitled something along the lines of The Changing Face of Qualifications. Who can we trust? Dun, dun, dun. It's something which members often ask about and email about, and it is a problem. What qualifications to do? Is this going to get me a job, etc., etc.? And the objective of this debate, which is going to have people from all across the industry, from different disciplines, people involved in education, people are involved in looking at the quality of education. They're all going to come together, hopefully, with me keeping the peace, I hope, talking honestly, in inverted commas, but hopefully we honestly about the current qualification structure, which, as we know, particularly in sports therapy and sports massage therapy, it's not regulated. People can call themselves whatever they want, whenever they want, and do whatever qualification. They can offer level 6, 7, 8. I would do a level 10 now. They can just make it up as they go along. Okay, so there is a problem out there. Is regulation the answer? That's another topic that might come up as well. It's not like physio, osteo, chiro, where there is regulation in your allied health professionals. It's a bit more of a minefield when you move away from allied health professionals. So they're going to be talking about this, talking about accreditation, awarding organization validity. And it should be really interesting for people who want to be part of this debate. So if you want to join that live, then come along to the Sports Therapy Association YouTube channel at 8 o'clock next Tuesday, which will be the 26th of September plus 7. October the 3rd. That was it. My maths is still there. October the 3rd. If you can't make it, then that's fine. Just make sure that you follow us on social media and subscribe to our YouTube, and you'll get a notification of when it comes up. That is next week. But for today and tonight, thank you once again, Lucy Gillbanks, for your time.
Thank you.
I'm just going to shut down the live lounge. Don't press any buttons if you can, because I just want to say thank you to you afterwards, after I shut it down. But thank you, people who joined us live. If you're in the Facebook group and you weren't able to leave comments, then just to reiterate, I'm putting it in the open group, but you do need to sign that click that Facebook link, otherwise you won't be able to put comments up there. But people who did join us live, thank you very much for your questions and your comments in there. And we hope you can make it again next week. Until then, take care of each other, and we'll see you soon.